Hello my dear friends and welcome to StudyIQ. I am Joyce Joy and today in this lecture we will discuss about the significance or importance for primary healthcare in India. Let us first understand what is a current affair that is related to the primary healthcare in India. So the development of health and wellness centers or the H&W centers is getting focused by the government more and more. Under the Ayushman Bharat scheme of the government, there is a special focus given on the development of health and wellness centers, and this points out to the fact that government is giving importance or increased focus to comprehensive primary health care in the country. So this has become an important current affair and we will analyze what is the significance or importance of primary health care in India. First of all, let us see what is the importance or significance. The union government has announced health and wellness centers under its Ayushman Bharat program, and under the Ayushman Bharat program the health and wellness centers have become a focus center, or it has been mentioned as the foundation for public health system in the country. So a foundation for the public health system is being tried to be created by the government under the Ayushman Bharat, which is an important scheme of the government, and health and wellness centers will be developed under this scheme. And this health and wellness centers under the Ayushman Bharat program are intended to provide outpatient care, that is OP facility, immunization, maternal care, child health services, non-communicable diseases and other services. And this primary health centers or the H&W health and wellness centers will be linked or connected to the secondary and tertiary care centers. That means there will be a coordination between this primary health centers and the secondary and tertiary health centers. And this health and wellness centers will be given or supplied with adequate drugs and diagnostic services. So once a strong foundation for this health and wellness centers are made, this will resolve the issue of accessibility to basic health services. We have seen that government is focusing to provide or supply this health and wellness centers with adequate drugs and also diagnostic facilities. So this will help the centers to eliminate a basic health problem of early diagnosis, early treatment of diseases and early medication available. So this early medication and diagnosis will help the patients to avoid the complications in the later stage. So it will have a huge impact on the secondary and tertiary healthcare services, because in the health and wellness centers, which are the primary healthcare centers, if early diagnosis and early medication is possible for the patients, this will eliminate the risk of later complications. And if there are no later complications, the cost of medication or expenditure on secondary and tertiary medication will come down significantly, thereby lowering the overall cost for health care or health services in the country. Now let us understand what are the advantages of primary health care. First of all, achieving a universal health coverage or UHC with a comprehensive focus on primary health care will ensure that the health care in the country will have higher coverage and lower cost. The reason is that if government is able to provide a universal health care, that is the health care for all, at the primary level itself, this will eliminate the complications of diseases or enhanced risk at the secondary level and at the tertiary level. So this will ensure that the cost of treatment will come down, and this will also ensure there is a higher coverage of health services in the country. So universal health care at the primary level itself is advantageous in terms of lowering the cost and also in terms of better inclusion or higher coverage. And secondly, this will have a significant impact on the out-of-pocket expenditure of the households. Various studies have shown that out-of-pocket expenditure of the households on healthcare has led to poverty in many households. Also, a huge proportion or percentage of income of the households is spent on healthcare for out-of-pocket expenditure. So, all these figures points out to the fact that if the government can provide universal health coverage through primary healthcare facilities, this will reduce the out-of-pocket expenditure of the households. And when the out-of-pocket expenditure of households for healthcare comes down, the households will have more disposable income. This means they can spend the extra income on other activities. This can help in building up the social capital, for example, education, skill development, etc. Also, the aggregate demand in the economy will increase if the households have an extra disposable income. So, in that term, it will lead to economic growth and economic development because the households can spend it on more productive activities like education, skill development, etc. So, this will also have a significant impact on the out-of-pocket expenditure of households in healthcare. And next, it will contribute to realizing the Sustainable Development Goal, goal number 3. So, goal number 3 under the Sustainable Development Goal is to promote good health and well-being along with adequate financial protection. So, this will also help the country to meet its Sustainable Development Goals, which has to be achieved by the year 2030. Now, this will also ensure lower rates of mortality and better health outcomes for the country. For example, countries like UK, that is United Kingdom, have already achieved lower rates of mortality and better health outcomes by reorienting its strategies towards primary healthcare. So, by giving focus on primary healthcare, it has been evident that many countries have become successful in reducing the mortality rates and also by providing better health outcomes. So, this will have a significant impact on Indian economy as well if government is able to provide universal health care at the primary level for all. Now, let us understand what more is required in order to achieve the target of the government to provide universal health coverage through primary health care centers. For that, the focus of the government must be diverted. Now, the government is focusing more on curative part. That means the disease is diagnosed and medicated. But an increased focus must be provided to the prevention part. That means government should pay more attention on preventing the diseases. For that, the focus of government should shift towards community-led, people-oriented primary care. Now, secondly, more focus must be given on the implementation part. The strategy development is easy. Planning is easy, but the implementation is the biggest challenge. For that, government needs to recruit more resources. There must be more skill development in the healthcare. More public health professionals should be recruited by the government. It should also design outreach programs, preventive programs, etc. in order to implement the health program effectively. Also, a trained pool of social workers, psychiatrists, counselors along with the public health professionals should be identified and they should be intensively trained in order to provide public health service delivery in the country. So, implementation part needs more focus. Now, third part is regarding the spending. At present, government spends 51% of its total health expenditure on primary health care. That means about half of its expenditure on healthcare is spent on primary healthcare. But this proportion has to be increased to at least 2/3. That means at least 66% of government expenditure on healthcare must be spent on public healthcare. And this was suggested in the National Health Policy as well. So, increasing the expenditure of government or spending of the government on the primary healthcare will also help in implementing the program effectively. And next one is the role of the states. In case of primary healthcare or provision of primary healthcare, the state governments have higher responsibility than the central government. The state government is in better position to understand the local needs of the states. So, a participatory approach must be adopted. The center must work with the states and the states should work with the local government in order to implement the scheme effectively. So, a proper coordination and cooperation between the center, state and the local governments is very necessary for the effective implementation of this project. You can find the PDF of this lecture on my Facebook page, and for any queries regarding your UPSC preparations, you can get in touch with me on my Facebook page, or you can email me at joycey.studyiq@gmail.com. Thank you.